Welcome to the Melbourne IVF Nursing Information Session. My name is Holly, and today I am going to provide information to help you understand and prepare for your IVF journey. I will talk to you about how our clinic operates, your cycle and the medications, and most importantly, what you need to do to get started. During this video, we encourage you to write down any questions you might have about the information presented. You will have the opportunity to discuss these questions with your nurse at your nursing appointment. If at any time the information seems overwhelming, please take a moment and be reassured that the nurses are available to provide you with any support you might need along the way. Now to start. Here is an overview of how the clinic works. Your IVF team is made up of your doctor, a small group of nurses, and patient liaison administrators. Where possible, you will be seen by the same team of nurses that are allocated to your doctor. Our clinic is open from Monday to Friday from 7 a.m. to 5 p.m. On Saturdays, we are open from 7:30 a.m. to 3:30 p.m. The clinic is closed on Sunday. For public holidays, please refer to our website. Our IVF nurses are available Monday to Friday between 7 a.m. and 4:45 p.m, either in the doctor's suite or at 344 Victoria Parade. You will be provided with the specific location details of your nursing team during your nursing discussion. Please note that you do not need to make an appointment to see your nurse at the East Melbourne Clinic during the course of your treatment. To contact your nursing team by phone, you can do so by calling the Melbourne IVF general phone number. If the nursing team are unable to take your call, a message will be provided from our reception team to your nursing team. A nurse will endeavour to call you back on the same day, but please be aware that any non-urgent calls made after 3 p.m. may be returned the following day. If you wish to contact us via email, you are welcome to do so. Your nurse will provide you with your nursing team email address at your nursing discussion. Please note that however you choose to contact your nursing team, you will always be asked to confirm your name, date of birth, and address. This is to ensure your privacy and to ensure you always receive the correct information. Melbourne IVF has a number of network clinics in and around Melbourne, which you can utilise to collect medications or have a blood test taken if it is more convenient for you. All network clinics are by appointment only from Monday to Friday from 7:30 a.m. to 3:30 p.m. To make an appointment, you will be required to contact the clinic directly. Please see the Melbourne IVF website for further details. Before you start treatment, there are a number of things you will need to complete. You and your partner will be required to complete a set of screening blood tests. These tests will be ordered by your fertility specialist. If you have results from previous tests, they need to have been taken within the last 2 years. You will also need to sign IVF consent forms. Your nurse will outline which consent forms you will be required to sign. At your nursing session, your nurse will talk to you about specific requirements in more detail, as some things may vary depending on your treatment. Prior to commencing treatment, you will need to have attended appointments with counselling, nursing, and the PLA team. Now it's time to talk about your treatment cycle. Your doctor has prescribed an antagonist treatment cycle. Here is a timeline of the events expected to occur during the cycle. Please note that this is based on a 28-day cycle length, and some details may vary depending on your response, your cycle length, and your past medical history. While we go through the treatment plan with you, please remember that during your treatment, the nursing team will be available to help guide you through and will provide you with written and verbal instructions along the way. When you are ready to start treatment, you will need to call the clinic to report day 1 of your period. Day 1 is considered to be the day of your heaviest flow. Some women may experience spotting for a day or 2. It is when the period is bright red flow that we consider it day 1. If this is before 3 p.m, this day is considered day 1. If full flow arrives after 3 p.m, the following day is considered to be day 1. If you are unsure when day 1 is, your nursing team will be happy to discuss this with you. When you call the clinic to report day 1, firstly, you will need to speak to a PLA to confirm payment. Once you have spoken to a PLA, you will be put through to your nursing team. The nurse will ask you to confirm your day 1 and your cycle length. Your treatment plan will then be discussed with you and provided in writing. You will then be able to make arrangements to collect your medications from our on-site pharmacy. When you attend the clinic to collect your medications, you are welcome to see a nurse for medication demonstration and to discuss your treatment schedule. Medication videos are also available on the Melbourne IVF website for you to view. Your first medication will start on day 3 of your cycle. This medication is called FSH. FSH stands for follicle stimulating hormone. FSH is a hormone naturally produced by your body every month to help the growth of one follicle. By supplementing you with synthetic FSH, we aim to recruit and develop multiple follicles. FSH is an injection that you will need to take once a day at the same time each day until your scan on day 8 of your cycle. You will need to have an ultrasound on or around day 8 of your cycle. In most instances, this will be an internal transvaginal scan. This scan is to assess your response to the medication. The scan will assess your endometrial lining, follicle size, and count. Your nurse will provide you with instructions with whom to book this ultrasound with. This may be your fertility specialist, a nurse, or an external provider. There are 4 possible outcomes on the day of the scan. The first possible outcome is that you've had little or no response. At this time, your fertility specialist might discuss cancelling your cycle or changing the plan. The second possible outcome is that you have had an over-response. An over-response is when you have 20 or more follicles. If you have 20 or more follicles, you could be at risk of ovarian hyperstimulation syndrome. We will talk to you about this in more detail if it is relevant to you. The third possible outcome is that the follicles are not yet the right size for egg collection. This is very common and means that you will need to have more FSH and another scan or 2 to monitor your progress. The fourth possible outcome is that the follicles are at an optimal size and you are ready for egg collection. During this time, a second injection will be introduced called an antagonist. This medication is very time specific as it will prevent you from ovulating. We expect your follicles to grow about 1 to 2 millimeters each day. Once the follicle is 18 to 20 millimeters, then you are ready for egg collection. Your fertility specialist will then advise the most appropriate date for your trigger injection and egg collection. On the day of your trigger injection, our day hospital will call you to provide you with a very specific time to take your trigger injection that night. It is important to take this at the specified time, as the trigger injection helps to mature your eggs in preparation for collection. During this important phone call, the day hospital will also provide you with a time for your egg collection and instructions to prepare for the procedure. If the plan is to use fresh sperm, your partner will need to ejaculate on the day of trigger and abstain from intercourse until egg collection day, where he will be asked to come in and produce a sample for fertilisation. The day hospital will provide you with a time for this. Your egg collection procedure will be performed under an anaesthetic and you will be required to have this day off. You'll be asked to arrive 1 hour prior to your procedure for admission purposes, and you will need to allow between 1 to 2 hours after for recovery. The egg collection procedure takes around 20 minutes to complete and will be performed by your specialist or a covering specialist under a light anaesthetic. A vaginal ultrasound probe, like the one used in your internal scan, is used to perform the procedure. The probe has a fine needle attached that is used to pierce through the vaginal wall for access to the follicles on your ovaries. When you wake up from your procedure, you will be advised how many eggs have been collected. Sometimes this number can vary from the number of follicles sighted on ultrasound. Sometimes not all your follicles have mature eggs. Post-procedure, you will be given something to eat before being discharged home. Please remember that you will need to arrange for someone to pick you up and stay with you overnight. Soon after your egg collection, the lab staff will reassess your eggs for maturity and will freeze all the eggs suitable to be frozen. The nurses will call you 2 days after your egg collection to see how you're feeling. Fertilization of your eggs takes place on the afternoon of your egg collection procedure. The following day, you will receive a phone call from our lab to advise how many of your eggs have been successfully fertilized. Once the embryos have been assessed, they are placed back into the incubator to grow or divide and become what we call blastocysts, or a multi-celled embryo. A blastocyst embryo is suitable to be transferred 5 days after your egg collection. 5 days after your egg collection, the embryos will be assessed again. Embryos that have reached the day 5 milestone will be frozen on day 5. Sometimes it takes the embryo a little longer to reach this milestone. These embryos might be frozen on day 6 or 7. 2 days after egg collection, you will receive a call from your nursing team. This will serve as a reminder to commence your LPS, luteal phase support, and also to see how you are feeling after your egg collection. LPS is a progesterone medication that will help to prepare the lining of your uterus and make it optimal for implantation of your embryo. This medication is usually a vaginal pessary. In some cases, your doctor will prescribe the medication in an injection form or a combination of both. Progesterone can often cause cramping and mimic pregnancy or premenstrual symptoms. It is important to keep this in mind after your transfer. In most cases, your embryo transfer will take place 5 days after your egg collection. You will be provided with the time for the embryo transfer procedure the day prior. The embryo transfer is very similar to a pap smear, and generally no sedation is required. On the day of embryo transfer, you will be asked to avoid emptying your bladder for 1 hour prior to your transfer. Having a partially full bladder assists with the placement of the embryo. You are not required to drink any extra water than you normally would. Once you are comfortable in our dedicated embryo transfer room, your specialist or a covering specialist will insert a speculum followed by a fine catheter into your uterus. The embryo is then transferred through the catheter to your uterus. The transfer usually takes about 15 minutes, but you will need to allow some time prior for admission and also some time after so the nurse can discuss the post-embryo transfer information. The next step in the cycle is your pregnancy blood test. This is scheduled 10 days after your embryo transfer. The nursing team suggests that you avoid home pregnancy tests in this cycle. The blood test is more accurate and can help to avoid disappointment from a false positive result. A conclusive outcome is essential for your safety, so it is important that you have this test, even if you have bled or believe that the cycle has been unsuccessful. If you experience any bleeding at this time, please contact your IVF nurse and do not stop your progesterone support. We hope this information has been helpful and we wish you the best of luck on your fertility journey.